And on the line with me this morning, Dr. Joe Congeni. He is our resident expert in sports medicine with Akron Children's Hospital. Good morning, Dr. Joe. How are you?
Great, Gene. How you been?
I'm doing really, really well this morning. I
Thanks.
understand this morning you want to talk to us about a particular kind of hand injury that's very common in golf and baseball.
Yeah, it's common, but it's kind of one of the articles I looked at last night called it the most missed pathologic finding and the most commonly missed diagnosis in the hand area. And so a lot of people that aren't aware of it don't know about this injury. And so I wanted to talk about it. This time of year is kind of like a smorgasbord for us sports lovers. The NCAA tournament just wound down, the NBA playoffs around the corner, baseball starting this week. And for golfers, the Masters is like nirvana. Everybody starts dreaming about being out playing golf after they see the Masters, and golf people love this tournament. And there's a lot of injury talk at the Masters this year. Is Tiger coming back? The last year's champion Matsuyama is injured. Is he going to be able to play? But I saw one of the biggest hitters and biggest stars on the golf tournament pointing to his hand the other day. The volume wasn't even up on my TV, but I could tell where he was pointing on his hand what his injury is, because in 30 years I've seen this injury quite a bit in the hand, and it is called a hook of the hamate fracture. And the hook of the hamate is a small bone. If people look at their palm of their hand, this small bone is in the fleshy part of the hand opposite the thumb, and there's a bone that's deep in there. There's a hard bone, and if you press on it, you can feel that bone. And what happens in sports where you use a bat, a club, a racket, the butt end of that club or racket compresses that bone, and a lot of times shear force across that bone causes there to be a hairline fracture or a complete fracture in that bone. And it's very hard to play those sports when they have a complete fracture. I was remembering from so many years talking about Cleveland baseball with the Indians. Listen to this litany of our great stars in Cleveland that had hook of the hamate fractures, Gene, in the last 15 years. Kenny Lofton in 1992, Jim Thome in 1996, missed a big part of that season, Michael Brantley in 2011, and Jose Ramirez in 2019, all missed time with fractures of the hook of the hamate. Part of the reason that it's so hard to diagnose is X-ray doesn't show it very well. There's a very specific X-ray you have to get, and many people aren't aware of that. They don't get the X-ray, or it's not at a time where you can see it, so it's missed a lot. It's picked up by a CAT scan 100% of the time. An MRI is not quite as good, but probably 90% of the time. And so you have to get an advanced image to pick this up in a lot of cases. And if we pick it up where it's still in the hairline phase, a lot of athletes try to get it to heal with rest. So this great golf star, Bryson DeChambeau, hadn't played in like 4 months trying to wait for this bone to heal. And now he's coming out in the Masters, and he's saying he's going to play with this injury in his hand. So we'll see how he does. We'll watch him this weekend. Many people, if that hairline fracture goes on to non-union where it doesn't heal, have to go on to surgery. And I think all 4 of those Cleveland Indian players from the past had to go on to surgery and miss significant parts of the season. So it's a little-known injury. It's called the hook of the hamate, and if you're watching the Masters this weekend, it might just be interesting to see how well Bryson DeChambeau, one of the stars of the golf world, has healed from this injury in his hand.
That's really interesting, Dr. Joe, and thanks for bringing that up. So I would imagine that as we wrap up right now, that if people injure their hand, whether it's in a sports injury or not, maybe keep in mind when they go get their x-rays to clue people in that are doing the x-rays, hey, maybe you might want to take this extra x-ray, right?
Yes, right. Or people that have really seen a lot of sports injuries or hand specialists. We're so lucky in our town, you know this. We have great orthopedic care. We have great sports medicine care. People that would be in a field of sports medicine or people, particularly hand surgeons, would know for sure. This is one that if you're really, nobody's diagnosing you very well, and that fleshy part of the hand is hurting, get in with somebody who's seen sports injuries quite a bit, and they'll be able to diagnose whether you have a hook of the hamate fracture or or not.
Excellent. Thank you so much. Dr. Joe Congeni, he's with Akron Children's Hospital. He is our resident sports medicine expert. We're always happy to talk to him. Thank you for being on with us.